Hi, I'm Dr. Sean Chaudhary, a board-certified chiropractic neurologist, one of only 1,000 in the world. And if you're watching this video, then you're having problems with carpal tunnel syndrome. Now, carpal tunnel syndrome is a very complicated problem. And what I mean by that is this. Your doctor may have checked you and said, oh, I think you have carpal tunnel. But what I'm here to tell you is that there's 6 areas that could potentially cause carpal tunnel-like symptoms. The first area is the carpal tunnel, right? We know that if something is damaged here within the median nerve, it can cause you to have numbness and tingling in these 3 fingers. Now, carpal tunnel does not affect these 2 fingers on the opposite side, which are controlled by the ulnar nerve. Now, you can have another area that could be a problem, and it's called the anterior interosseous. And it can cause you to have anterior interosseous syndrome, and you can have the same symptoms as carpal tunnel. Now, there's another area called the pronator teres. Now, the pronator teres are basically a muscle which has 2 heads to it, and the median nerve runs between it. And it can be pinched off by excessive computer use and keeping your arm pronated for long periods of time. Now, you could have more symptoms from an area up here called the brachial plexus. If there's a problem in that area, you could also have carpal tunnel-like symptoms, which is numbness and tingling within the first 3 fingers of your hand. And you could also have a problem with your anterior scalene muscles here when you turn your head back or put your arms up. You could have numbness and tingling occur as well. Now, obviously, another area that could give you problems is your neck. You could have a herniated disc, a bulging disc that could be pinching off a nerve in your neck. Now, the last area that could be giving you problems is the parietal lobe in your brain. It can cause you not to feel things quite the way you should. So does it make sense that it's not that your surgeon did anything wrong, and the reason that you have carpal tunnel is because he messed something up in your surgery, or whoever was working with you didn't do a good job, and maybe because there's 7 other areas that could give you this problem. Does that make sense? We also have to look at inflammatory markers, things that can cause inflammation, because a lot of pregnant women get carpal tunnel symptoms and syndromes. And so what we need to do is that we need to evaluate inflammation. We need to look at your blood chemistry. You may need an EMG, nerve conduction velocity test. Now, how do we fix it? It depends on where the problem is at. We can use laser therapy. We may need to use decompression therapy, traction therapy. We may need to use things that increase sensation in your hand. It all depends on what your individual problem is, but what it requires is an appropriate physical examination. Now, if you're dealing with these symptoms of carpal tunnel or neck pain or shoulder pains or symptoms in your arm and you don't know where they're coming from or what you've done hasn't worked, then you need to call me today. Call me at 337-478-5634. Or you need to check us out at Recovery Physical Medicine and look at your neighbors that have had tremendous results with these conditions at recoveryphysicalmedicine.com. Don't live with the pain. Call me today.